And in this week, guys, we are going to see a new topic. We're going with the topic of medical tools. Medical tools, herramientas médicas, medical tools, medical equipment. That is the topic. We are not going to see the topic in very deep terms. It's an introduction of it in simple form with simple elements. But anyway, I think it's going to be good for you to get introduced to this world of medical tools and everything. And it's a good chance to combine English and your career again, you know. So that is always the objective, you know, to practice more English, to improve your English by connecting it at the same time with your profession, future profession, your present career, right? Right. So the first thing we're going to do, very few people today, so thank you very much for coming. You are really good and responsible. The others, so thank you very much for coming here. Camila, Cristóbal, Nicolás, Paula, Franco, Valentina, Victoria, Ignacia, Sofía. I will remember your names. We're going to start with a video, okay? Para no tener problemas de copyright, que ya los tuve en otro momento, voy a poner el link del video y ustedes lo van a ver, ¿ya? Cada cual con su, no lo voy a pasar acá por el Zoom, digamos. Cada cual con su teléfono o computador. Dura 2 minutos, 2-3 minutos, muy cortito. Entonces, you're going to watch and listen to the video, and the question is this. What medical tools are mentioned in the video? So you're going to watch and listen to the video and respond to this question. What medical tools are mentioned in the video? There are 5 tools mentioned, okay? Déjeme compartir el link. ¿Dónde está el link? ¿Te me fuiste? No. Lo cerré, pero lo voy a buscar al tiro. Denme un segundo. Veterinarian tools. This is it.
We are.
Okay. So the name of the video is Veterinarian Tools, and you have to watch, listen, and tell me which 5 medical tools are mentioned. Okay? Do it now, please. Thank you. So the video is very short, and tell me, try to respond my questions. What is the first medical tool mentioned in the video? Yes, Sophia, stethoscopes. Stethoscopes are very important for doctors, human doctors, animal doctors, veterinarians, of course. What can you do with a stethoscope? What is the use of the stethoscope? The stethoscopes are used to listen to the body of your patient. You know, you can listen to the organs, the heart, the lungs, the stomach, the abdomen, all the organs of the patient, and you can obtain a lot of information about the health state of your patients by using this important device, the stethoscope. Okay? Do you have stethoscope now, or you still have to buy one? They are a really cool tool, you know, and you always know that, that's a doctor because he has the white apron and the stethoscope, right? Yeah, very cool. What about the second medical tool mentioned? Absolutely, Valentina, books. Is that a surprise? Kind of, yeah. But yeah, books are essential, you know, in medicine, as in many other areas, but in medicine, absolutely. So maybe these days you are not using paper books, you know, you are more in the internet era and you use more digitalized elements. But anyway, you have to read a lot, right? And you have to know and read a lot about medicine and illnesses and patients and animals. So books are essential because you have to get and understand many details. The doctor said that it's very detailed, the knowledge of animals, right? After that, what is the third element? Absolutely. Mm-hmm. And what is the use of the pen in the case of veterinarians? The pen is used to, yeah, the doctor is using a synonym, sorry, which is more cool, to document. You have to document everything because, as in human medicine, in animal medicine, you have to keep charts. You have to keep up medical charts. They contain a lot of information you have to write, you know, las fichas médicas, que contienen todo, 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 todo. Mientras más información, más detalles, mejor. So we use a pen now. Maybe you can use a laptop computer or a computer, but anyway, you still have to write. And I think that the most practical element is still the pencil, the pen. So we have the stethoscope, the books, the pens. What is medical tool number 4? Yes, Sofia. Scalpels. In Spanish, you say escalpelos or bisturís, right? And what is the use of the scalpels? The scalpels are used to cut the skin, yeah. To cut the skin, to make cuts, incisions, right? And they are used in surgery. They are used in surgeries. In surgeries to perform surgeries, right? Sí te entendí, Sofía, no te preocupes. Sí, 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 the skin. So, when you have to perform surgery, you have different surgical tools. Surgical tools, such as scalpels, are used in surgeries. Surgical tools, such as scalpels, are used in surgeries. And the doctor who performs surgery is a surgeon. Surgeons perform surgeries using surgical tools. In the future, would you like to be a surgeon? I think it's very cool, you know, to be a surgeon, especially because you have to cut the skin and perform and save lives, you know, to perform surgeries, to use different surgical tools, such as the scalpel. And the element number 5 is another surgical tool that the doctor mentioned. What is medical tool number 5? Yes, Valentina, hemostats. So we have 2 surgical tools here, hemostats and scalpels, and they are the most commonly used tools to perform surgery. Hemostatos y escalpelos o bisturís. They work together. You cut using the scalpel and using scissors, tweezers, and hemostats, you open up and contain the different tissues to operate. Los hemostatos son una especie de tijeras, pero sin punta, más bien redonda al final, que son una especie de pinzas para contraer tejido, para apretar tejido, para sellar venitas, sangre, mientras uno opera. Unas pinzas un poco más especializadas. Hemostats. Okay, very good. Very, very good. So this is the first activity. Now we're going to continue with the second activity. And I'm going to show you a picture with more medical tools, with an expansion of medical tools. All of them are very common, very simple. So now we're going to watch the picture and you are going to repeat after me all the pictures, all the elements, all the tools. Okay? So let me show you that. Está cargando. Aquí está. Por favor, díganme si lo ven bien.
Sí, profe, se ve bien.
All right. Thank you very much. Ya, vamos uno a uno. Ustedes, por favor, repitan sin micrófono, en voz alta, pero sin micrófono para que no quede un escándalo, ¿ya? En la comodidad y privacidad en su hogar. Vamos. Stethoscope. Stethoscope. Scissor or scissors is more common in plural. Stretcher. Stretcher. Magnifier. Magnifier. Weighing scale. Weighing scale. Torch. Torch. Face mask. Face mask. Tuning fork. Tuning fork. First aid kit. First aid kit. Gauze. Gauze. Rubber gloves. Rubber gloves. Scalpel. Scalpel. Ambulance. Ambulance. Tweezers. Tweezers. Microscope. Microscope. Otoscope. Otoscope. Thermometer. Thermometer. X-ray. An X-ray machine. Saline bag. Saline bag. Syringe. Syringe. Medical chair. Medical chair. Pills. Pills. Cane. cane, wheelchair, hot water bag, nunca está de más, hot water bag, bandage, aquí falta una E al final, bandage, curita, crutches, and ointment. Do you have any questions? Do you have any questions, people? Students? Me imagino que no, entonces.
Profe, una compa preguntó en el chat.
What is cane? Una, ¿cómo se llama? Muleta. Y era media rara la... Parece, esas son unas muletas más especializadas, pero... Muleta, ¿ya? La imagen era media rara. Sí. Anything else? Las tweezers, pinzas, ¿ya? Pinzas. Tweezers. Y el tuning fork es un diapasón, que yo lo conozco más para la música. No sé para qué se ocupen en términos médicos. Ahí queda un poco pillo, ¿ya? Pero bueno. Ustedes a lo mejor lo pueden chequear ahora. En el siguiente... Ya, me estoy perdiendo la concentración. Perdón, estaba buscando alguna información sobre el diapasón, tuning fork, pero no importa. Ahora viene el ejercicio de verdad, ¿no es cierto? Porque estos son ejercicios fome, po. Repita después de mí. No. Now you're going to use your English. So now you're going to work with all these medical tools in this way. I'm going to divide you in pairs, and you're going to describe one element, one medical tool, without saying the name, and your partner is going to discover the element. So, for example, I'm going to give you two examples first, and then I will divide you in pairs. So, this medical tool, y así van a empezar siempre para que sea fácil, this medical tool is used to, okay, this medical tool is used to transport people, especially to transport sick people to the hospitals. In fact, it's not a medical tool, it's a vehicle. So this vehicle is used to transport sick people from the hospital or to the hospital. What is that? Ignacia says the ambulance, and that is right. So that is the activity you're going to do. One more example. This medical tool is used This medical tool is used to measure your temperature. This medical tool is used to measure your temperature. What is that? That's right, thermometer, right? So you're going to do this, continue with that, with this activity for 6, 7, 8 minutes. Try to practice a lot, please. Use a dictionary if you don't know, and you're going to do it in pairs. Les voy a compartir el link antes de separarlos de la imagen, ya para que lo tengan ahí a mano también. Okay, let me make the groups. Okay, good practice. We'll get back in 7 minutes. Okay, was it good practice or not? ¿Definieron todo? Qué bueno. ¿Alguna consulta? ¿Alguna cosa que no pudieron decir? ¿Alguna descripción que les falló? ¿Comentarios? Todo le funcionó perfecto. Vámonos para la casa. Me voy a almorzar.
Profe, a mí me costó como la del kit,
¿Cuál? ¿La del cuál?
como la del kit,
La del kit. Ah, ya.
y la cosita roja.
La más
O sea,
fácil.
como que me falta pronunciar bien lo del medio.
First aid kit.
Eso, sí,
First
me
aid.
cuesta.
First aid kit. First aid kit. ¿Y averiguaron para qué servía el diapasón, el tuning fork? Yo averigüé mientras tanto. The tuning fork is used to revise or to test the hearing, the ears of the patient. It's very good for that, to check if your ears and your hearing is working well. Any questions? Any questions? Camila, ¿no te alcanzó el tiempo? Tú sabes que el tiempo en la televisión es escaso. Y aquí estamos en televisión, pues. Visión a distancia. Any particular questions, my friends? No? Okay. Okay. Van a ver un videíto corto sobre algo muy interesante. Este es como el futuro, the future in medicine. Which is called surgical robotics. And you're going to watch, and it's just to know about the new possibilities in medicine, and to know that usually and constantly we have new technology and innovations applied to medicine, you know. So maybe this is going to be the future for medicine and for surgeries. So let me show you the video. No, es mejor que lo vean ustedes. Les voy a poner el link para evitar el tema de la copyright. Y volvemos después con un pequeño comentario, ¿ya? Okay, dura 1 minuto y medio. It's very short. So please watch the video now. And then we come for comments and to close the class with the activities for this week. Okay, so what do you think of this video? Do you have any comments? Well, I have my personal comments. I think that the video is really cool, and it's wonderful to see how the technology and science advances all the time, and we have all these incredible innovations, and maybe in the future we are going to have this kind of robotic surgeries in many hospitals, you know, and maybe more available for common people, not only for rich people. I think it's amazing how everything is changing. Do you have any comments? Would you like to be operated by a robot or by a person? A person, the human touch. Yes, I don't know. But it's funny, in the video, we can see that the robots are working together with the people, you know, with the doctors. They are using a joystick to control and some special gloves to control the robots, which act as an extension of the body. So you have a combination of forces. And also, I imagine that in the future, we will have only robots performing, not humans doing anything whatsoever, but all kinds of different situations. But I think the future is going to be much more common, you know, to see all these innovations. So you people of the future, young people, have to be prepared for that, for robotics in medicine. And many other changes, who knows what. Okay, and I'm going to show you the activities for this week. Y estamos. Este es el complemento de la clase. Por favor, hagan todas las actividades. Las primeras dos ya las hicimos. Picture number 1 is Common Medical Tools, con la cual practicamos. Ahí está el link. Number 2 is the video of Veterinarian Tools, que ya vimos y practicamos para que lo refuercen. Activity 3 is new. It's a video containing vocabulary with 100 medical instruments. So this is an expansion of instruments. Let me show you that.
Wharton-Berguio. ECG machine. Gloves. Gowns.
So that's a video with 100 medical equipment. Hospital equipment. That is a lot of information, all right? Les recomiendo que no solamente lo vean y repitan, sino que traten de describir cada producto, cada elemento de la forma que lo hicieron en la práctica reciente. Eso les va a ayudar mucho para su inglés oral. Activity number 4 is Wikipedia. This is a link from Wikipedia with instruments used in medicine, with pictures and definitions. Let me show you that. It's very interesting, very cool, very practical. So you have a list of the most typical medical tools. Bedpan, for example, a little definition. Catheter, a catheter. Otoscope, some of them repeat, you know, some others are new. Ventilator. So information and then the picture so you can practice, right? And the last one, number 5, is a quiz. So this is a link for a quiz, and you have a picture quiz with medical equipment. Very cool, and you can check yourselves if you are learning or not. And that's it. I'm going to upload the video and the materials in a few more minutes. I don't know if you have any questions. If you don't have any questions, that is all for today. And I hope to see you next week for a few more activities on this topic and for blog post number 3, which is coming next week. All right? No questions then. Thank you very much for coming. You are very responsible people. I appreciate that. And I hope you have a good rest of the day and a better weekend, right? See you guys. Take care.
Gracias, profe. Chao.
Bye-bye. Take care.
Chao, profe, gracias. Que esté bien.
You too. Bye-bye.